I'm Daniel, I'm 31 years old. At 7 months old, I had a shunt placed and most recently had a shunt replacement for an adult shunt. Typical Florida boy, sandals, beach, no shirt. I love the outdoors, definitely stay active as can be. Ride bikes every day if I can, go to the gym. Recently I've started rock climbing and it's sparked an interest to start climbing bigger and better mountains. So most recently I went to Africa. I climbed Mount Kilimanjaro, and most recently I went to South America and wanted to do Mount Aconcagua, and that's just my new thing. So hiking, traveling, seeing the world. So at about 7 months of age, I apparently had an ear infection. My parents took me to the doctors and they thought there was nothing to it. Gave me some antibiotics and went on my way. The headache started coming even more and it started getting a fever, 107 I believe it got up to. It continued, and then I was one of all children's first shunts to be placed. At about 5 years old, the shunt became disconnected and we had to go back in for a small revision, and ever since then I've been fine. Never seen a neurosurgeon since, and just kind of never been a bubble child. I worked, I would say, a Friday night, and then Monday morning woke up, had a massive headache, nothing to it. A couple weeks went by, I still would have headaches nonstop, started blacking out a little bit, and then it got even worse. Finally took some medication, went to sleep. Next morning I woke up, could not see. My vision was gone. Coming down the stairs and letting the dog out was almost impossible. And then getting upstairs just to call my mom and lay back down, found myself not remembering much at all. Didn't even know when she showed up. She must have found me on my bed or on the ground.
When I saw him, he was diagnosed with a very severe shunt malfunction that he had clearly been suffering from for somewhere on the order of 2 to 4 weeks, with marked progression of his symptoms and acute loss of his vision.
Meeting Dr. Befeler was the best thing.
Given Daniel's symptoms and image findings, we elected to proceed with emergency revision of his ventriculoperitoneal shunt.
He basically said that the shunt has failed. It's time for surgery. Let's go to OR now. And said there may or may not be a chance that you'll ever get your vision back. I mean, of course I was devastated, but in my eyes, I want the honest answer. I want you to be honest.
For me, I think that my goal in neurosurgery is to humanize neurosurgery and bring that compassionate, caring element.
He knew what was wrong and he fixed it immediately. Got out of surgery, could see, could eat, was extubated. I mean, everything went as smooth as possible and was released in 2 days. Now I'm working out again, going to school, driving, and just going back to work. I love my job, and working with the kids just fulfills my dream. If I remember anything, I went in feeling satisfied and confident that he was going to take good care of me. He walked out with my mom and just said, "Hey, look, we got this."